Okay, so I just wanted to welcome everybody back. You're now in Helen's hands.
Thank you, Julie. And thank you to all of you who are with us to the end. We really appreciate it. And you will not regret being here for what I know is going to be an amazing panel discussion by many of our thought leaders on how we move forward. So we are now going to be transitioning from looking back and celebrating what has been accomplished to date to thinking ahead about how we're going to build on that foundation and accelerate our work into the future. Because as any of you who attended the lunch presentation or anything else heard, as Steve Whitman said, it literally is a matter of life or death. So what we're going to do today is I will quickly go through some conference highlights to recap, and then we will transition into our esteemed panel, and then I will offer some closing remarks about our future directions here at Suhi. So looking back, we've had quite the day. I've been popping in and out of sessions, so I've gotten glimpses of everything. I do want to tell you all that we have recorded all of the sessions and you will have access to the links. So if you missed anything, none of us could be at all places at the same time, so you will have an opportunity to go back. We had an opportunity today to really reflect back on where Suhi has been over the past 20 years. Dr. Maybank started us out by sharing some really valuable insights that she has gleaned on the vitality of centering and advancing equity within public health and healthcare, and focusing both on embedding it within our organizations, but also in terms of our work and how we can move that forward. She called out hate and racism explicitly as public health issues that need to be identified and rooted out, and really inspired us to be co-collaborators in this work. Depending on the sessions you attended, I'm not quite done, but this is fine, you can keep. We heard about Suhi's work in assessing the presence of health inequities at a hyperlocal level in Chicago, creating knowledge by, for, and with communities. You probably heard that quite a bit. We also talked about expanding inequity research to consider the impact of structural racism and focusing specifically on the death gap in America's largest cities. There were a couple of panels that had to do with community health worker work, and we'll talk about quite a bit about that as we move into our future as well, but specifically thinking about leveraging community wisdom, assets, and power to improve health and address social barriers to health, and also around community-driven response to COVID-19. And we also had a couple sessions around assessment and evaluation and collective impact evaluation in particular. So hopefully you had a chance to learn from our esteemed Suhi team. All right, next slide. All right, so we're going to transition into our panel now, but before we did that, I wanted to at least put up one slide that really defines health equity, as I hope we will talk about it today and as we will dialogue about it, because it does go beyond health conditions. So this is a definition from the Robert Wood Johnson Foundation that I like because it's very holistic in how it addresses this issue. And it says that health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs and fair pay, quality education and housing, safe environments, and healthcare. And we could add to that list, right? So I think that provides a nice foundation. I also put up a schematic. There's many like this, and they all have their strengths and their weaknesses. This is one I like because it really puts the system into the conversation. So in it, and any of you who are fans of Shel Silverstein probably recognize this is adapted from The Giving Tree. But essentially, on the far left, you see inequality. So you see a tree that is leaning disproportionately towards one child, and that child is therefore having access to the fruit, whereas the other child has no access. We can give both children the same thing. So we give them both a ladder of the same height. And now the one child, the one that the tree is already leaning towards, has access to the fruit quite easily, whereas the other child still can't quite get there because the system is leaning against him or her. And then we get to equity. So equity, we now are giving the children both what they need to access that fruit and that tree. But ultimately what we want to get to is justice. So we want to actually move the whole system to not disproportionately favor one child over the other. And that's what we are aiming for here today. So with that, I'm going to transition now to Kaliva Wilburn, who will be moderating our panel. So I'm going to introduce Kaliva and she'll introduce our panel. Kaliva Wilburn has served as a public health advocate and professional for over 15 years, working within the healthcare delivery sectors, shaping public health policy, and community-based philanthropy. Cleva is currently the CEO of Wilburn Strategic Solutions, Inc., a consulting firm providing support for the for-profit and nonprofit sectors at the leading edge of social impact. Wilburn Strategic Solutions serves three key sectors: healthcare, community development, and philanthropy. And so, Cleva, you are a wonderful person to lead this panel, and I will turn things over to you.
Thank you, Helen, for such a kind introduction and for a great level setting for our conversation today in this closing panel. Our closing session panel will highlight those partnerships that exemplify the three central themes that drive Suhi's vision for the future: collaboration, innovating and scaling, and community-driven health solutions with a health equity lens. Let me introduce everyone who's with us today to this afternoon's panelists. During this panel, we'll be hearing from Gayla Brockman, President and CEO of Michael Reese Health Trust.
What are you talking about?
Leslie Bond.
Please mute. Yes.
You remember Dr. Eggman?
Okay, I think, all right, I think I'm back. It's a quick pause for life. So during this panel, we'll be hearing from Gayla Brockman, President and CEO of Michael Reese Health Trust, Leslie Mitchell-Bond, Sinai Chicago board member, Maria Pesquera, President of the Healthy Communities Foundation, and of course, Karen Titelbaum, President and CEO of Sinai Chicago. So thank you, panelists, for joining us today and for joining me in what I hope to be a really engaging and thoughtful discussion. So let's start, Leslie, with you. Leslie, you're currently working with the North Lawndale community stakeholders to design and build a community-based and community-led museum designed for children from birth to 5 years, with a strong parent and caregiver engagement component and zones of interest that appeal to children of up to 8 years. The museum is a wonderful example of multi-industry collaboration and innovation and community investment, which all work to impact community wellness on multiple levels. As a Sinai board member, Leslie, and a North Lawndale Community Coordinating Council consultant, that's a lot of C's, can you share with us how NLCC and Sinai are innovating collaboratively to improve health by focusing on those social determinants?
Sure, thank you very much. So Sinai's role in creating a whole health village as part of the Ogden Commons project is another demonstration of its commitment to caring not just for individuals, but for the communities in which those individuals live. The North Lawndale Community Coordinating Council, NLCCC, makes it easier, is a group of stakeholders, as you said, that includes community-based organizations, business owners, elected officials, and residents who came together to create a quality of life plan for North Lawndale. And that plan addresses housing, economic development, transportation, infrastructure, green open space, arts and culture, health and wellness, and public safety, essentially everything you would want in a quality of life plan. And planning for the Discovery Center is led by the NLCCC in partnership with Sinai and many, many others, and really presents a historic opportunity to transform early childhood on the West Side through the lens of the social determinants of health. Now, the fact that it's going to be built on the top of a 42,000 square foot grocery store called Urban Market, which will offer nutritious, affordable, and culturally relevant food, and where most of the employees will come from the surrounding communities, further adds to its potential to improve health outcomes. So every aspect of the Discovery Center is being designed by the community for the community. And for decades, Sinai, as you all know, has championed that healthcare is a right, not a privilege. But when you consider children, it is play that is a right, not a privilege. Play serves as the driving force of all development, social, cognitive, physical, and emotional. Children need ample opportunities, both inside and outside, for play to thrive. And we know that children living in poverty experience greater levels of toxic stress than middle-class children. And that stress can lead to physiological and neurological adaptations. And those negatively infect the way their minds and bodies developed, and it can impact their success in school and life. So the strongest protective factors in safeguarding against the effects of that toxic stress are safe, stable, and nurturing relationships. And the Discovery Center is going to offer a stress-free environment for children and their caregivers to simply play and enjoy their relationships. Since I just have a few minutes, I want to give you a little bit of a taste of how this collaborative play-based museum will improve individual and community health. It's designed for children and caregivers beginning at birth. And that's when research tells us is the best place to start if you want to change the trajectory of a child's life. So imagine an infant toddler area with a safe space to crawl and explore, critical information about developmental milestones in English and Spanish that will be featured in creative, accessible ways, and designated times when a Suhi community health worker will be on site, maybe to answer a question about breastfeeding, maybe to address postpartum depression issues. There are a range of possibilities. Then you might walk over to the pediatrician's office where children will role play being a patient and a professional. And there will be helpful information on pediatric asthma and childhood obesity, and might be facilitated by a child life worker from Lurie Children's. There'll be a child-sized version of the urban market, so children can push a cart and weigh their vegetables, pretend to be cashier, all while their caregivers are gaining access to heart-healthy, low-sugar recipes reflective of culturally competent ingredients, and along with fruit and veggie prescriptions so they can go downstairs to the urban market after their visit. There'll be a cozy corner with a book collection featuring Black and Brown authors, illustrators, and characters. A multi-purpose room offering an economical, safe place for a birthday party, or maybe a yoga mindful meditation class to support mental health. There'll be an outdoor playground with green space, promoting exercise and reducing the nature deficit. Each of these exhibits will be designed to maximize children's feelings of competence, autonomy, and relatedness, traits that research, again, has found to motivate them to persevere through challenges, delay gratification, and demonstrate impulse control. And we're working closely with the Chicago Public Schools Office of Social and Emotional Learning so that SEL-related content will really be embedded in each and every exhibit. And I want to close by saying that even though the Discovery Center will be located in North Lawndale, it's a joint effort between North and South Lawndale, hence the Lawndale Children's Discovery Center. So as these two communities unite to create the space, their children will be united through play, breaking down cultural and geographic barriers. We believe that this cultural institution will draw from many other parts of the city, but the deep commitment to community investment and collaboration, it will stay true to the people living there now. Thanks.
Thank you, Leslie, for sharing a really great example of complex and innovative partnerships between Suhi and its community. Next, we'll hear from Gayla Brockman about Suhi partnerships that help to facilitate innovation, incubation, measuring, and scaling. In 2020, in response to the pandemic and the unfolding social justice movement, Michael Reese Health Trust and its philanthropic partners established the Health First Fund, a 5-year plan led by community partners to narrow the gap between public health and healthcare. The first demonstration pilots focus on community health centers as innovation hubs. Gayla, can you tell us more about how these pilots focus on innovation and health transformation to eliminate racial health disparities, and how the partnership with Suhi is supporting incubation, measuring, and scaling?
Sure, thank you. And thank you for having me on this panel. It's so nice to see you all at the end of this lovely day. So I hope we end this it's been a great day. So I just want to thank everyone for all the hard work going into this. Let me tell you a little bit about Michael Reese first, and then put it into context to answer your question. So at Michael Reese, our mission is to advance equitable access to health solutions for all Chicagoans. And we do this in 3 programmatic ways. We do grant making, which many of you are familiar with. We do advocacy, and we do incubation. Now, we've been working in Chicago as a grant maker since 1990s, before my time. But in 2018, we became what's known as a public foundation. And as a public foundation, it gives us the ability to do a lot more with the resources that we have. And it allows us to work a little differently. So as a public foundation, we're able to incubate promising practices that address Chicago's health challenges with our colleagues, and we can mobilize the resources we need to support the success of these exciting initiatives. As a public foundation, we can actively participate in advocacy. Private foundations are limited in that part of their work, but we're able to do a lot more, and that allows us to lift up promising strategies with our public partners. And then as a public foundation and an incubator, we're willing to take risks on new and experimental ideas with Chicago's visionary leaders. So we become their partner. We literally roll up our sleeves. We take the risk of launching and resourcing new initiatives so that our partners can do what they do best. So that gets us to where we are today. So last year, as we all know, at the start of the pandemic, the world began to see what many of us in this Zoom call had always known, and to which actually Karen referred to this morning in her opening comments. And one is that public health is everybody's business. And 2, health is a commodity that is inequitably allocated. So for those of us working in this field, we know that the color of your skin, where you live, where you work, where you play, where you pray, how you get to work, the jobs you have, all of these aspects feed into our health and our opportunities for good health. So as a result of the pandemic, we saw incredible innovation happening around us and some successes coming from our safety net providers. These are community-based organizations and the communities. And what they needed was money. And guess what? We have it. And they needed it fast. They needed the seed money to fund these community-led initiatives so they could focus on their work. And that's what made the birth of Health First Collaborative happen so quickly. So Health First Collaborative invests in community-led innovative solutions to address root causes of racial health inequities and improve the physical, mental, and social well-being of all individuals and families in our region. We do this through the support of demonstration pilots that can be replicated and scaled. And our first cohort of those pilots focuses on community health centers as hubs of health transformation. So in 2020, the Health First Collaborative made its first grants to 3 pilot projects. Some of you may have been on calls today where you heard a little bit about these projects. We're investing in these pilots over the next 3 years, and this investment will give the pilots an opportunity to build, to grow, to even experiment and take risks. And our goal is to sustain those projects with the goal of eventually seeing systems levels change. There's that advocacy piece again in healthcare delivery. So you may have heard about the pilots. One has to do with using technology to coordinate care and expand access to specialty care. And this is an investment in technology systems that integrates electronic health records from 5 community health centers in Black communities to facilitate health management across the collaborative and enable specialty care coordination. Basically, their goal is to demonstrate value-based care and incentives for specialists to partner with these communities to influence policy and actualize and increase the reimbursement for managed care organizations. The second pilot is to bring healthcare to where people are, and that is a build out of telehealth microsites co-located in social service organizations in patient communities that leverage trusted community partnerships to increase access to care for uninsured people. This pilot will test a model of care that can be replicated across really free and charitable clinics in urban and rural areas, making access to health much easier. And finally, the third pilot is using teletherapy to expand access to behavioral health care. This is an expansion of integrative behavioral health support through the Latinx communities. And this pilot will establish evidence and best practices for integrating telecounseling in all care delivery, and then use those learnings to advocate for improved reimbursement rates to sustain the services. So a key component to incubation work is to be able to share our success. Evaluation is key in doing that, as we all know. And for those of us who are funders, we're always asking, how do you know you're effective? So we, being the funder, said we better be able to answer our own question. And so at the same time that we were helping these projects define what they were going to be doing, we reached out to our partners at Suhi to determine their interest in playing the evaluator role in these projects. And guess what? With enthusiasm, they set out to develop impact evaluation frameworks for the individual pilots, as well as a collective framework across the collaborative. Since then, Suhi regularly convenes the pilot project leads for learning opportunities and is also leading 2 community advisory councils. And I love this work, but I have to say, this piece, which I would never have thought of myself, is one of my favorite pieces. They do one in Spanish and one in English. And Jackie Jacobs could talk about this so much better than I can, but it ensures the work that is guided by the people most impacted. And so they'll use this data to elevate the opportunities for healthcare systems impact. So our goal through the whole Health First Collaborative is to redesign the systems so that Black, Latinx, uninsured, and other disinvested communities in Chicagoland can define healthcare for themselves, access the services they need, and live and maintain healthy lives. Kind of simple, actually. So through partnerships with organizations like Suhi, we get closer and closer to making this goal a reality.
Thank you, Gayla, for sharing with us all the phenomenal work of the foundation, the Health First Collaborative, and how Michael Reese Health Trust is partnering with Suhi to incubate, measure, and scale health transformation in Chicago's communities.
Can I make one more thing that this is so off script? I'm like acting like something.
Absolutely. If you can do it in 10 seconds or less, you got it, Gayla.
I have to make a plug for Kaliva because she's the one who got us all started on this pathway. And if it wasn't for her, I don't know if we would be this far along. So hats off to you.
Thank you, Gayla. Also, sidebar, your checks in the mail. Next, we'll hear about Suhi partnerships that support community-driven health solutions with a health equity lens, and how Suhi partnership with the Healthy Communities Foundation helped to set its course in health equity, grant making, and partnership in the region in which they serve. As the president of the Healthy Communities Foundation, Maria, can you describe for us the partnership that you've had with Suhi over the years and the development of the Healthy Communities Foundation's Zip Code Health Rankings Report, and also how that report helped to shape the foundation's community-driven grant-making strategy with that lens towards health equity?
Thanks, Kaliva. First of all, congratulations in this 20-year milestone to Suhi and the Sinai Urban Health Institute for being such forward thinkers as we see today. Some of the conversations 20 years ago were started at Suhi. And as I think about my partnership with Suhi, as Kaliva mentioned, had many years of collaboration with Suhi that actually predates Suhi at the Sinai Urban Health Institute. And as I think about how forward-thinking the Sinai Urban Health Institute has been as a result of this partnership with and being incubated at Sinai Institute. Previous to my life at the Healthy Communities Foundation, I was at an organization that is based not too far from Sinai, and through that partnership at that organization, there was the very first SAS in the state of Illinois, which is a supportive screening, assessment, and supportive services. And back then, the idea was, as you think about it, looking at the social determinant needs as we think about mental health services. So again, going back many, many years that even predated me at that organization. As I think about partnership and collaboration, it certainly comes from that great spirit of an organization such as Sinai. And so as I think about when I came to the Healthy Communities Foundation, I recall I think it was week 2 at Sinai, at Healthy Communities Foundation. It was week 2, and I am listening to this presentation about data collected, and I realized we've got a partner at the Healthy Communities Foundation. So let me back up a little bit about the Healthy Communities Foundation, who we are, and why the partnership with Suhi was so important. Our organization restarted. It was reconstituted, and as we restarted the organization, we needed to really look at where do we go? What's the data? What's the information out there about our communities? And how do we assess the information that is needed? And so on that week 2, as I listened to Suhi's presentation, it made sense for us to partner with Suhi early on. So the information that Kaliva is mentioning, which is looking at the zip code analysis, Suhi came to look at our overall region that makes up 27 regions. The Healthy Communities Foundation provides services or funding in a 5-mile radius around our founding location, which is McNeil Hospital. So a 5-mile radius takes us into both the suburbs as well as the city. And what Suhi did was they used the county rankings of each one of our zip codes. And what we found, going back to equity, that not every one of our zip codes was as healthy as can be. So using those same county health rankings, we know that the healthiest county in the nation is DuPage. And so it is no surprise that the one zip code that bordered DuPage was one of the healthiest. And what we did, or what our board took a look at, was if we wanted to take a look at addressing, if we were true to addressing health equity, then funding equity, as was stated earlier, is not about equality. And so if you look at our map on our website, you will see that in our 27 regions, we have, while the entire region is important, we fund the majority of our resources into our equity and legacy zones. So this is what Suhi helped us start with early on. And Suhi was one of our very first partnerships, as I mentioned. So for the Healthy Communities Foundation, we aim to achieve health equity in our region by addressing the medical and social systemic factors that influence overall health. And this is what this study or this data helped us take a look at. So as I think about this, we as a foundation have opportunities as we move forward on this. And I would say that those opportunities include the fact that Suhi has helped us discover these opportunities through these rankings. So acknowledging this critical role that the Suhi plays is, I think, truly important for all of us in our community as we celebrate 20 years of Suhi being in place. So while, as I mentioned, 20 years ago, I can't recall many folks speaking about equity. I can't recall folks speaking about social determinants, and yet I can say that Suhi helped lift that up in our region or in our area. And so for that, I think we in our region need to celebrate this because Suhi certainly was one of the first to look at it, at the social determinants of health. The importance of gathering data, understanding community needs at the hyper local level, and why it's critical to lift up solutions that can truly address the needs. And knowing that there is no one size that fits all approach when we talk about advancing health equity. And so as we think of the impact that COVID-19 has had on local communities, we need a Suhi. And it's timely to celebrate. And so as I think about collaboration in between funders and stakeholders, and really getting towards greater impact, we know that collaboration is critical towards achieving health equity, and it can't happen in silos. The work that Suhi does, addressing the social determinants of health, lifts that. But Suhi also not only lifts it, lives it. And so as we think about the pilot that the Healthy Communities Foundation is involved with, along with the Community Memorial Foundation, that was a joint partnership, Suhi has been key in the community health worker pilot. And Suhi has certainly, I think you all got to hear a little bit about that partnership earlier in the sessions. But certainly this partnership and the work and the collaboration of Suhi in this work have been key. We heard from community early on related to the need in our region about the need for culturally competent models of care and the lack of awareness of social services in the Western suburbs. And certainly the community health worker pilot was an opportunity for us to address that. The social care infrastructure, as we know, would not be able to keep up in the region, and the addressing the social infrastructure needs through the lens of community health workers were key.
Thank you, Maria. Thank you so much for your feedback. And thank you for sharing all the ways that you as a leader have partnered with Suhi over the years. And of course, the most recent collaboration in support of the Healthy Communities Foundation. I want to bring us to a close with Sinai Chicago's leader, Karen Teitelbaum. Of course, Karen has been working as the leader of Sinai, as a collaborative partner with Suhi's leadership and staff on all of the things that we've talked about today: collaboration, innovation, scaling, incubation, community-driven health solutions with that health equity lens. And Karen, I wonder if, as the leader of Sinai Chicago and a big picture thinker, if you could tell us how Sinai's collaboration with community partners to advance the role of community health workers, as Maria was just describing with us, exemplifies scaling, collaboration, and community-driven solutions with a health equity lens. You're on mute, Karen.
Oh, just once. I'd like to get through a presentation without that.
It happens to all of us.
Okay. Well, I just want to start by thanking my fellow panelists. I know that Leslie's vision and the work that she's doing with community partners on the Children's Museum, so exciting. And I saw in the chat room, May already said she can't wait to visit the museum. We have to get it up first, May, but it's exciting. And thank you to both Gayla and Maria, who have been wonderful funders, not just to Sinai Chicago, but to really all of Chicago and the safety net. And as importantly, thought partners for all of us in Chicago. So thank you. So collaboration, health equity, and innovation. You know, Sinai for 100 years has really had to be innovative. Because of our constrained resources. So for 100 years, this is the way that we've done things. We've always collaborated. We knew that we couldn't do it on our own. And really we do it now because that's just the right thing to do. And I think that it's the way that most care is being thought of at this point. Most work in the safety net communities, these vulnerable communities, is being thought of. So let me just give an example, and we'll get to the community health workers because they're so pivotal in this, and I'm very passionate about the work that we do. If we think about COVID and we think about that with the lens of collaboration, health equity, and innovation, sadly, that's a great example. While the rest of Chicago had a mortality rate of somewhere around 4.5%, the patients at Sinai Chicago had a mortality rate of an astounding 18%. And why is that? Because, and let me also say the positivity rate, if the mayor and the governor are concerned about positivity rate in Chicago of creeping up 4%, the positivity rate at Holy Cross Hospital in Sinai Chicago was as high as 28%. Why would that be? It all has to do with health equity, in my opinion, and the disparities that we see. It's not only the issues of access to care, because we're there for the community, but not everybody can access the care. Not everybody can take time off from work. Not everybody has transportation. It's living situations. Many of us have the luxury of being able to socially distance in our own homes. In many of our communities, that's not even an option. Going to work, having to take public transportation, all of this played into what we saw during the pandemic. And so during the pandemic, we were like glue, partnered with our community, whether it was the federally qualified health centers, our wonderful partners, North Lawndale Community Coordinating Council, and LASE. We were all focused on the same things. We were looking at how do we educate about the resources that are available? How do we educate now later, once vaccines were available, how do we educate about vaccines and increase that uptake? We had a COVID hotline. We wanted to make sure that people could access, if they couldn't come out in person, we wanted to give every opportunity, in addition to the community health workers being right there in the community, working with the community members. We had a hotline. We worked with the small businesses in the communities to talk about, once the first surge was done, how do we bring people back safely to work? So all of that, there wasn't a playbook for this. So we talk about innovation, we talk about collaboration. These are the things that keep our communities healthy. We invested in the diseases that really cause these comorbidities. For example, diabetes. We've got 3 times the national rate. This is from our Suhi research. Heart and vascular disease, we've invested in that. And then telehealth. Boy, I'll tell you, that's been a real godsend when we talk about equity. And when we talk about equity, we have to make sure that, and our community health workers know this well, because they are in the homes, they're working with their neighbors. We have to make sure, it's one thing to have telehealth, it's another to have internet access. So we make sure that our community has access to the internet. And we also support audio only. So lots of pivoting during this pandemic, and innovation and partnerships around how do we keep the community healthy, particularly during COVID. So then let's shift to vaccines. And this is where, I think our community health workers, not only during the vaccine stage, but also during the contact tracing. I know you heard about that today, but you talk about being able to take this jewel of a workforce. And I'm giving kudos not just to, my own beloved Sinai community health workers, but community health workers throughout, I'd say, the state, throughout the country. We did a pivot, as you heard, to contact tracing. We also put community health workers in our emergency department. So as people were coming in, the community health, and once they were stabilized, the community health workers were able to talk about, we're not just going to put you back in a situation that got you here. How do we work with you and what you need to have a safe return home? How do we keep you safe? And we've got our own, I'm going to give a plug to Gayla, without her Michael Reese hat, but in the hat of partner, transporting seniors to get them there. So you can see how this ecosystem all works together in terms of making sure, and this is just in COVID, take those kinds of examples and multiply that through, you heard about from, Kim, amazing colleague, one of my favorite, among favorites, I always say. You heard about what we do in asthma and in these chronic diseases, but you can see how we can take this asset and really, I'm going to use the word pivot again, where we're needed. So to me, that's all about using Suhi work to identify the equity issues, the disparities, and then being innovative, using the jewels that we have.
Thank you, Karen. And a big thanks to all our panelists this afternoon for your innovative approaches to collaboration, innovation, community-driven health solutions with a health equity lens, and of course, for your longstanding partnership with Sinai Urban Health Institute. I'll turn it back over to Suhi President Helen for her final remarks.
Thank you. Thank you, Kaliva. Thank you, Leslie, Gayla, Maria, Karen. I really wish we had more time for that dialogue because it was so inspiring. So thank you for that. Well, I will now close us out. Thanks again for sticking with us till the end. I'm going to give a brief assessment of where Suhi is headed in the future. Our learnings over the past 20 years positioned us well, as you've heard many times today, to quickly respond to this shifting landscape brought on by COVID-19 and the heightened awareness of systemic racism as foundational to many of the health inequities that we see in our country, in our city. So we want to continue that work. We want to accelerate that work. We've had a lot of opportunities to grow our Suhi work over the past year because we were so poised to respond that we don't want to lose that momentum. So over the next 5, 10, 15 years, we want to continue to accelerate and move that work forward. Central to our success are those themes that you've heard our panel addressing. So collaboration will continue to be pivotal. The collaborations we already have in place and the partnerships will continue to be key, and we look forward to building new ones. We want to continue to innovate, to incubate, to measure, and ultimately to scale our learnings to broader audiences. And finally, we are going to continue to be community-driven, health solutions focused, and always have health equity at our center. So really, at this point, we're ready for Suhi 2.0, taking Suhi to the next level, scaling our learnings to really address the systemic issues that underlie health inequities. So stay here on the slide, Amanda. Sorry, I think you were ahead of me. So with regard to what are we going to continue to do, not everything is going to change. We are going to stay true to that vision and that mission that have always been part of who we are. We are looking to lift and to launch and to build off that foundation. So our vision is not changing. We are going to continue to be focused on communities and communities thriving in health and that partnership with community and co-leading solutions. We're also going to stay focused on health equity as our central guiding principle and continue to utilize that lens to guide our work. All right, next slide. All right, there is so much on the horizon, and so I had to focus somewhere today. So I chose to focus on some of our key initiatives in 4 main areas, and those being community transformation, workforce development, strategic partnership, and collective impact. And again, always around communities thriving in health. And so you've heard threads of all of that presented today in our present work, and we will continue to build that into the future. You also no doubt heard quite clearly that Suhi has certain guiding principles that underlie all of our work and all the work that we choose to dedicate ourselves to. So we will continue to focus on data first and foremost, hyper-local level data that's contextualized with community and data that's actionable. We will continue to be community driven. We are a research institute. That is that is who we are. We are an applied public health research institute. That's how I tend to define us. And however, the type of research we focus on is participatory and will continue to be, and will accelerate that work into the future. We will be co-creating, we will be equity centered, and we are also going to continue to focus on bringing forth assets from communities, from our partners, our stakeholders, ourselves to really be asset-based and strength-based in our approaches. So going through just a few examples again, because there are a lot of things that are on the horizon for Suhi, but let's talk through a couple of them. We've heard a lot today about our work with community health workers. When I was hired 20-ish years ago, and with funding from the Michael Reese Health Trust, so it's all coming full circle, I was hired to do the evaluation for our first ever pediatric asthma intervention. And that intervention utilized community health workers. We weren't calling them that at the time, but that's that's the model that was central to that work. So we are at a point now where the country is really accelerating the work around community health workers. So we want to continue to leverage a systems thinking approach to accelerating the uptake and integration of community health workers towards a maximal impact on health inequities and on growing, thriving communities. The Biden administration has plans to, and has started actually, to invest more in communities that experience racial health inequities, and specifically in the community health worker workforce. I believe there's about 150,000 jobs that the administration is committed to adding in the CHW field. We also have had other reports and organizations that are focused on public health job corps sort of creation. And I've heard up to 500,000 community health workers as being instrumental to really moving the needle towards health equity. So we will utilize the strength that we have in this realm, build off of the consulting and training work we are already doing to continue to build out the community health worker workforce within different sectors, different systems, including integrating them more holistically into our Sinai Chicago system. Around community transformation work, this is going to, again, we've done a lot of work in specific areas. So if we go back to community health workers, we've done disease-specific work. We've done work in asthma and diabetes, in navigating women to mammograms, things of that nature. And what we want to do now is we want to bring the entirety of what we do at Suhi, from assessment to solutions to evaluation to partnership. And we want to scale it towards a meaningful change at the community level. As one example, we are launching a Lawndale Community Health Worker Neighborhood Transformation Initiative. We have received some generous gifts from our philanthropic community to bring together North and South Lawndale organizations that are utilizing community health workers, not always calling them community health workers, but those positions that are working directly with community, community-facing, supporting communities, creating connections to identify those organizations, many of which we know, but some of which we don't, and to work with what's there to coordinate it, to measure its impact in a more collective way, and to do this together. So this is again about co-creating with the community serving organizations that already have strong community health worker programs in many cases, this coordinated neighborhood-wide model that hopefully will move the needle a bit more quickly towards health equity. And I don't have a lot of time, and I want to make sure we get to a video I want to show you. So the other realms you've heard a lot of today, but really workforce development, including building on what we've been doing with COVID-19 to continue to grow the workforce that has come into place around COVID-19 to become community health workers or to move into other healthcare or allied healthcare careers, social work careers, building pathways in workforce opportunities within communities. And really focusing on that collective impact piece and ensuring that we understand how investments into communities are moving the needle towards health equity, towards racial equity. All right, so I could go on as is clear, I'm sure, but I want to put up a video that is going to show you a few more voices beyond mine. Our Suhi team more collectively put together this Future of Suhi video, and it's about 2 minutes, so hopefully you'll stick with us. You'll be glad you did. So Amanda's going to get that up for us. On partnering with communities to better understand and address health inequities. Our work is changing the lives of the people who work here and the people we serve. The mission drives each of us at Suhi to work collaboratively with community to improve health and well-being, changing the way people think about and address population health.
We are able to make actionable change, and that we are intentional in the work that we do to help improve the lives of others.
As we always say, we are that bridge, right? To make sure that everything is connected.
And by us being a part of that bridge in connecting, it's just a way of thriving.
We can't do this work alone. No one person, no one organization can do this work alone.
And I am personally excited about harnessing the partnerships that we have developed over the next 20 years to create even more innovative approaches.
For our communities, spirit is rich. Spirit is essential. And when you honor people's spirit and what they feel, you give yourself a platform to be able to help.
Many people are starting to see the importance of the issues we have addressed for the past 20 years. And now we're poised to help people channel that awareness to action and equity in the communities we serve.
Individuals are now awake to a lot of these issues that have been longstanding. And I believe we will stay at the forefront of population health because we are establishing change within these issues.
Empowering the community is really the best approach because it's only the community that knows what the community needs.
Having people at Suhi who actually live in those communities, who are residents of communities that we serve, I think gives us that insight.
I'm just really proud to be a part of an organization that is serving also individuals that look like me. I think that makes me pretty emotional because that's just not the case everywhere.
It just keeps pushing you. It gives you that energy to be like, yes.
Looking forward, we commit to continuing to use our power and position to co-lead the charge in ensuring that all communities thrive in health. That's what the future looks like, and that's why I'm excited for it. Okay, well, with that, we will close out our day today and our celebration of Suhi's 20 years and hopefully we're ending on a hopeful note for the future. So I think we dropped evaluation to the chat. Please also look for the email from us and do take some time with that evaluation. Yes, goosebumps. I'm teary right now, so I can't speak much more. But thank you all for your time and your gifts.